Good morning, everybody, and welcome to day 2 of Singularity University's Exponential Medicine. My name is Kate Warnock, and we're here live at the GuideWell Insights Lounge. Our very first guest today is Esther Talboom. Esther, welcome to the interview.
Thank you very much.
Esther is the Chief Executive Officer of Saltro. Esther, you come here with an international perspective. You're here all the way from the Netherlands. I was wondering, do you think that we are in the midst of a healthcare renaissance?
Yes, well, actually I think so. And that's the main reason why I am here. We have a great healthcare in Europe and the United States with good quality. But sometimes we've forgotten the position of the patient. And with all this new technology that we've heard about at Exponential Medicine, I think we have a chance to really put the patients more in a central position, to ask the patient as a consumer, what do you want from healthcare? Instead of that doctors decide what is best for the patient.
Right.
So I think it's not about a renaissance about technology, but it's a renaissance more on the social side. Whose position is the most important?
It's a fascinating perspective, and I think that we had a lot of guests on yesterday who really shared that the feeling that the patient and that social part of health is really going to be what's disruptive in the future.
Yes.
Esther, in the next 3 to 5 years, what do you think will be the most significant innovation to change healthcare delivery?
Well, in relation to what I said previous, the most important innovation is that all innovation will be patient-centered. So we should, and we are going to use the innovation to give the patient a more emancipated position. The patient should be emancipated so that he understands why he gets sick. A lot of illnesses in the Western society are lifestyle-based. There are because people don't have a good lifestyle. They should change their behavior. And we should use all the innovation like e-health, like data, like information to teach the patient how to behave and how to change his behavior to be healthier, to be more fit, and to not get diabetes or cardiovascular disease,
right,
which is a very big problem, huge problem in our Western society.
Right, right. Well, Esther, again, as you're here from the Netherlands, something that I think is a global aim is the triple aim, affordability, access, quality care. What do you think that the U.S. health system has gotten right, and what can we learn from foreign systems?
I'm very much inspired of the Kaiser Permanente system, the Kaiser Permanente model.
Yeah.
I think they've implemented the triple aim care very well. And we can learn a lot about that in the Netherlands. What Kaiser Permanente did is integrate the insurance company with the general practitioners and the more medical specialists. It's integrated care. And in the Netherlands, it's not integrated, it's all separate. It's separately financed and it's separately organized.
Right.
And that makes it very difficult for us to organize care triple aim. To organize care with low costs, with good quality and with good service. And what the United States are especially very good about is to combine service with quality. We in the Netherlands are very much interested in costs and in quality, but sometimes we forget the service for the patient, that it's nice to be a customer as well. Patients are also customers. And we are also happy, we're always very happy to be in the United States because the hospitality is so great here, in care, in shops, everywhere. So we really can learn a lot about that.
Well, I know that over the next several days there's going to be many conversations where we're learning from each other, and I know that's part of the big missions of Exponential Medicine is to convene thought leaders like yourself here. One more question for you. What does the empowered patient of tomorrow look like?
Well, the empowered patient of tomorrow is a very well informed patient. It's a patient that goes to his doctor. He already knows the information about his diagnostics. I'm a CEO of a diagnostic center. We are very keen on giving the patient all the information he needs to talk in an equal position with his doctor and to make a decision together about treatment, to make a decision together about what to do, how to solve the problem that he has. So that the doctor doesn't tell the patient what to do, but they decide together. It's called shared decision making. So the patient of tomorrow is a patient that is so well informed that he can make a decision together with his doctor.
Well, I think that democratization of the patient experience is only going to yield a far more effective and hopefully helpful future. So Esther, I want to thank you for your time today. Enjoy the rest of the conference.
Thank you.
My name is Kate Warnock. Please join us again soon at the GuideWell Insights Lounge.